This is Broken Truth with John Davidson, and today we have Dr. Angelina Farella, and we're going to talk about the challenge of dealing with big hospitals when you're the little guy, or in this case, girl. If I'm allowed to say that.
Absolutely.
Okay, good. Welcome. Good to see you again.
Thank you. Thanks for having me, John. I appreciate it.
Yeah. Just a little background. Dr. Farella and Clinton and I met at CPAC in Florida a few weeks ago. A few months ago, I guess, is what it really was. And we all hit it off. And so Clinton and I came up with the show, and Dr. Farella was kind of there for the primordial goo of creativity that was birthing this Broken Truth. So, Dr. Farella, you are in Texas, near Houston?
Yes, Southeast Houston. And, we're in that wonderful state that everyone thinks is just the saving state, along with Florida. But, we have our issues here too. But yes, in Texas, we have a little bit of leeway. And I am a private practice pediatrician. I've been in private practice now for over 20 years,
right.
My own solo practice for 18. And, I've been a pediatrician for 25. So when you're looking at pediatrics over the long term, I have a lot that I've been kind of contemplating in the last couple of years, obviously.
Right. Yeah, I have a few friends that have their own practice, and it's been a challenge. It's almost like things were changing in the background in anticipation of this world that we're in. But that would require
Absolutely.
some sort of conspiracy, which of course no one here believes in. Therefore, it's just a matter of massive coincidences that made it where EMRs were difficult, right? Do you find EMRs to be a challenge?
Oh, they're ridiculous. They are ridiculous.
Weren't they supposed to make things better?
They were supposed to, but I knew from the beginning that really what it was is a data collection. That's all it is. It's just to track data, to get information on people that I don't know who's collecting it. I don't know who's looking at it, but really that's what it was for. I'm sure it's for the government. I'm sure it's for the insurance company's benefit, because it's certainly not for the patient benefit, and it's certainly not for the doctor's benefit.
Right.
EMRs have been a requirement if you are taking on any CMS affiliated insurance companies, and that's basically any Medicaid or Medicare. Mm-hmm. So prior to 2017, I did everything on paper. I had all paper charts. I love paper charts. I joined an MSO, which is a medical servicing organization, and they take a lot of Medicaid and Medicare, even though I don't personally. I still had to get the EMR, mm-hmm. which in pediatrics, it's never personalized to pediatrics, so it's always a hassle. I'm in my office all day, and then I'm doing 2.5, 3 hours worth of work after that. So yeah, it's a nightmare, and that's all unpaid time, obviously.
Right.
So the EMRs are burdensome on purpose, and they really have been a hindrance to patient care. Honestly, they've
right.
been a hindrance to proper follow-up for doctors. I think, they're burdensome. I could
Sure.
open up a paper chart, look at every lab, very quickly and methodically, but in the EMR, you have to click to each visit and go back and forth. It's just, the click problem is real. We hate it.
So how could it be better?
Well, first of all, personalize or template, or whichever way you want to call it. I don't really like templates, frankly, but EMRs need to be very specialty specific. For kids, they have different developmental stages, so they're very different throughout their entire childhood. A 0-year-old, so to speak, is way different than an 18-year-old, right? Mm-hmm. And so our EMR needs to reflect that and change with our age groups. And that's not, it's just I always say this computer is pretty smart, so it should be able to do these things without
Right.
me saying the obvious, which is, why doesn't this thing see the date of birth and like pull up the right template for that patient, right? For that age
Right.
group or whatever. So that's how it could be better. I personally like to see an EMR that looks more like a chart, more of what we're used to, you know. Going back and just looking at labs sometimes is very burdensome. You have to keep clicking back and forth, back and forth. There isn't very good features when it comes to charting those labs all together, to watch trends and to just follow up. So there's definite places for improvement. But overall, they're just burdensome and time consuming because, do you want to be in the room with your patient, actually connecting with your patient as a patient and physician relationship? Right. Or do you want to have a computer between you and your patient because you're sitting there tapping? And I refuse to bring a computer into the room with me. That's how I've always been. And I'm not going to change that. So I just feel it really burdens the patient-physician relationship because it puts a barrier, which is your computer, between yourself and your patient. And if you're looking at your keyboard and you're typing around, you're just a overpaid secretary at that point.
Yeah. And are you using anything that connects to Epic?
Not that I know of. But I think almost everything connects to Epic.
Yeah, well, we'd done a story on Riley Jones, who we found out or we suspect that the hospitals were sort of warning other doctors not to give her proper treatment through the Epic system. And, like she had pneumonia in her lungs, but they didn't want to see it, the little 8-year-old girl. And so instead they put her, or not instead, but they did also put her in a psych ward for 3.5 weeks when she had pneumonia, or at least around the time she had pneumonia. I don't want to say, because as soon as I say one thing, it's wrong, and then everybody beats you over the head with it. But the situation was she didn't get proper treatment,
and that seems to be a very sad state of affairs, and it seems to be a common chord lately. Right. The last 2 years have been an absolute horror show for patients. We have patients calling our office all the time saying, I will not go to the hospital. I don't care. I'm not going. I'd rather die at home, than be mistreated and separated from my loved ones. And, all the bad things that we think is just such a nightmare. I mean, dying alone is just, to me, one of the worst outcomes for a human being ever. And it doesn't matter how old you are. It doesn't matter what your status was prior. It doesn't matter if you're demented. It doesn't matter if you're, it just doesn't matter. You need another human to be there, specifically, hopefully one of your loved ones, and in our family, we have lost 3 of our family members during the pandemic. Right. And one was 93 years old. That was one of my aunts. And she lived in a nursing home, and she was excellent, health. The woman walked all day, every day until the lockdown, right? And then they made all the residents stay in their room. They weren't allowed to interact. They weren't allowed to walk around. This woman walked 5 miles a day. Wow. In her 90s. Okay. So locking her down was like the worst thing you could possibly do. Her family was not allowed in. She has a very large extended family. We have a huge family on the Italian side. So, but just her children, her grandchildren, and her great grandchildren, they rotated and they saw her all the time. And so, her being separated from her family made her feel like they forgot about her. And about 2 months into the pandemic, that was it. My oldest cousin, her oldest son, basically told the nursing home that he was not going to allow her to die by herself. And he said, unless you have an armed guard, I'm getting in there. And he sat with his mom for 4 hours until she passed. But, how many family members are willing to do that? And so that's just a sad thing. I mean, that's happened twice in my family. And I don't know. It really breaks my heart that this kind of nonsense is going on over I'm not saying COVID was totally fake, because it wasn't. I mean, we had really sick people. I treated thousands of COVID patients, and I did lose two, but they went to the hospital. I took them as far as I could and really tried to implement some home care. We just didn't have the support at home. And so they had to go in, and unfortunately they didn't come out. And they really got, I don't know. I can't really comment on their care because I wasn't there, and I'm not privy to a lot of what goes on in a hospital. But it's very disappointing, to say the least. I mean, that's a very mild way to put it.
Right.
But it's truly disappointing what we're doing to our patients.
Do you think, are we seeing any improvements in anything since COVID began?
Yeah, I think there's a few things. I think a couple of us doctors are being real innovative, and we're doing hospitals instead of hospitals. We let them stay at home as long as they have great care at home, some help at home. Then we can actually set them up to get a lot of really great care inside their own home with their loved ones surrounding them and helping them. So we've been doing that now for about a year and a half. I have some colleagues that was a really big focus area of their practice over the last year and a half. We're doing some really excellent, innovative, and out of the box doctoring.
Sure.
Telemedicine has taken off. I've been doing telemedicine since 2017. So telemedicine to me is not new. And I've been doing telemedicine, if you really want to get technical, for 25 years, right? Because patient calls on the phone and you talk to them. And, so in pediatrics, that's pretty common for us. I mean, we're on the phone all night, all day. I mean, parents call us at all hours. That's just how it is. So, for me, telemedicine is just a natural extension of what I already do. It's nice to get paid for it because, in years past, prior to 2013, we couldn't get paid for any phone calls. I mean, every once in a while, I would get a insurance company that would pay for my phone call, to my patient. But a lot of times they were not compensated. We did tell our families, like, look, if you're going to bother us after hours, we're going to charge. Sorry.
Right.
And that's just kind of how that went. In some cases, it went over just fine. The parents are grateful to have us readily available, and others didn't like it because their insurance pays for everything.
Right.
But telemedicine's great, but it has its limitations. We need to touch our patient. We need to, see what's going on. We need to examine our patient. So, but there's a place for it. And we've really been excellent at providing excellent care via either video conferencing or telemedicine on the telephone.
I was listening to the Paul Gosselin trial. I think we talked a little bit about that on the phone, but he was a DO in Maine, and he was suspended for writing exemption letters for 5 or 6 medical workers, hospital workers, who were going to quit their job if they were forced to get the vaccination, which was mandated by the hospital illegally. Probably illegally. It should be illegal. If it's not,
No. So it absolutely is under federal policy, but nobody is pointing this out. And I wish I had the letter. I'm not in my office. I'm at home. But I have a letter at my office that basically that shows you the policy number and for investigational injections. Okay, there's a federal policy that you have to give a patient or a subject, whatever you want to call it, very detailed informed consent in order for them to comply with an investigational injection.
Right.
So we need to change our verbiage, I think, so that it fits the federal policies and so that we can use that when it comes to abuse, because there's been so much abuse of this. This is ridiculous. I'm a pediatrician. I give vaccine out all day long. I've given out tens of thousands of vaccines in my career. So I really think, honestly, I'm a vaccine expert when it comes to side effect profiles and things of that nature, and what we have been doing over the last 25 years. And I can tell you that there is exemptions to every rule. Okay. Sure. There are people that have had vaccine adverse events and don't even know they had vaccine adverse events because they didn't put two and two together. And we're seeing that like crazy right now, right? People are not putting it together. And that's really upsetting to me because I'm very vigilant in my practice in trying to make sure that safety is paramount. And I can tell you, I have a lot of families now that have come to me and said, we've never had problems with our doctor in the past allowing us to either spread out our vaccines or not take certain vaccines.
Sure.
But ever since 2020, they are getting pushed to fully vaccinate their children. So there's got to be something going on because I'm a private doc. So, this is hard for me to even comment on as far as kickbacks are concerned, but I'm sure there's some kind of incentive or something that is saying, we have to reach an X number or X percentage of fully vaccinated children. I know there were programs in the past about that. I could tell you for sure. But I don't know how that was tied to compensation. I never thought it was compensation, but I haven't been part of a large university or medical system in the last 24 years. So unfortunately, I can't really comment to that, although I'm very highly suspect.
Right. Well, one of the ways in his situation that they were able to use that against him was that he didn't physically evaluate the patients, the medical workers that he wrote the exemptions for. Mm-hmm. How can they punish somebody for something like that when we have teledoc every day where they're actually prescribing medications? There's like, oh, well, you didn't physically evaluate them. Well, then did they? My supposition is that they've invalidated teledoc in Maine.
That's possible. I mean, but here in every state, here's the thing that's so confusing, right? Because in every state, there's certain rules about how telemedicine can be done in that state. Okay. Under the emergency declaration, which we, by the way, are still under the emergency declaration, physicians were, for the first time ever, allowed to use telemedicine across state lines. Okay. As long as it had something to do with COVID. Okay. So one of the things that, came to mind for me was, look, I'm in Texas, but let's just say I needed a second opinion from someone at Mayo Clinic. Okay. That's in another state. It's far away. They're experts in their fields. So I made a phone call and asked for a telemedicine visit and did a telemedicine visit just for a second opinion. Mm-hmm. That's valid. I mean, 90% of our diagnoses come from histories. Mm-hmm. Okay. So, yes, we're supposed to do our physical exam, but a lot of times when we're looking at someone, we can evaluate certain states. We can tell if they have tremors. We can tell if they have cranial nerve damage. We can tell certain things. We can also ask, hey, can you stand up and walk over there or whatever, just ask them for certain things. And so there are certain modalities now that patients can interact with their computers and doctors can get more valid information. There's stethoscopes now and all kinds of fun stuff. But right as we speak now, and when we're talking about something that was so widespread, it's kind of like if it walks like a duck, it's probably a duck, right? So when we're talking about COVID, for instance, right, it's like fever, cough, shortness of breath, brain fog or headache, severe headache, sometimes abdominal pain, vomiting, blah, 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 all these symptoms, right? Mm-hmm. We can figure out how to treat the symptoms before we even touch the patient. So what are we worried about? Are we worried about appendicitis? We might be, but that's part of our questioning. Hey, is the pain in a specific area? When you push on it, does it hurt? That kind of stuff. So you can still do a cursory, quote unquote, exam via telemedicine, but in a lot of cases, especially things like adverse events in vaccines, or they wanted an exemption. They know their history. They know what they reacted to. They know how it went. Basically they're healthy human beings for the most part, with the exception of they had this weird reaction and there's an issue. Or of course, we've blown this last 2 years so out of proportion because we're forcing people to do something that, number one, is not even FDA approved. Number two, has never been done before. And you've always had people that have dissented, and that's okay. We have people all the time that don't take flu shots in the hospitals.
Sure.
But do we ostracize them? Do we ridicule them? Do we isolate them? Do we discriminate against them? No, we don't. Never. I've never seen it before. I've never seen doctors walking around a hospital with a mask on just because they didn't take the flu shot.
Right. Yeah. No, this has been preposterous. Part of this is, I think, my punishment for being so paranoid and freaked out about it so early. And now I yo-yoed so far now in the other direction. I was like, wait, everybody, something's wrong.
Yeah.
So I think a lot of people were like that, but some people just never got out of it. Like there are people walking around here in California today. Just now I was at the beach. There were 2 people walking around with masks on. And it's like, you're outside at the beach.
Well, last night I was at a restaurant with my daughters, and we were outside. We were sitting outside, wind's blowing. It was absolutely beautiful outside, and the table next to us, very far away, like way more than 6 feet outside. And the gentleman did not have a mask on, but the woman did. Outside, eating dinner. And I'm like, this is ridiculous. This is 2 years later. Like, I don't know. We've never done this before. And unfortunately, I think the brainwashing has been so, unfortunately, excellent.
Yeah.
That we are going to have a really
Phenomenal.
hard time pulling those people off the cliff.
Yeah. I don't know what to do about them. I think our goal is just to try to snatch a few embers off of the fire before they burn up. And embers being people, anyone that really wants out, we'll try to help you out. We'll show you what we found that maybe will make you help. Maybe you can sleep at night or whatever it is. But so in terms of dealing with hospitals, one thing we've found is that the hospital doctors tend to have a clout to them, that like they're standing on the shoulders of a giant, and then they can kind of bully you guys. Is that the case, or am I wrong?
No, you're not wrong. There's a kind of like a God complex within a university system. They're used to doing it their way or the highway. You can't really introduce any discerning thought in some cases. So this is unfortunate because this is something that has been ingrained over the last probably 15, 20 years or so, because I could tell you when I trained, you kept that local MD or the PCP or whatever you want to call it, the patient's doctor in high regard because they know their patient. Mm-hmm. And we as admitting physicians at the hospital, we were taught to highly respect what we called LMDs or PCPs, right? Local MDs or their primary care physician. So the attitude that we are seeing lately is very foreign to me because that's not how I trained. I trained to hold the physician of record in very high regard, to make sure that we took their advice because they knew this family, they knew this patient, and then to utilize that the best we could to kind of carry on care as in the inpatient setting with the most continuity as possible. And then when we discharge that patient, to call the doctor or send a report to that physician to let them know, hey, this is what we did. This is your update, and your patient's going to come and follow up with you and XYZ, whatever. So I was trained very differently. That's how I trained. And so communication was key. We had a little kind of a saying that was called, we said, share the blame, which basically it was like, keep everyone informed. This way everyone understands what's going on. And that actually will reduce any kind of iatrogenic problems or, miscommunications with the patient and the family or whatever. So I was trained differently. What's happening now is really, really upsetting because they basically kidnap our patients, right? So we give them a report, or we try to give a report. We tell them, like, this is what we're thinking. This is what we are needing to be confirmed for the hospitalization. This is what we would like to get done. We try to have what I call intellectual banter, where we talk back and forth and say, okay, what do you think is, and so you kind of, you have a team effort to make the correct diagnosis, be cost containing when it comes to doing labs, because if you've already, like, if I did labs as an outpatient here, let me share my labs. You don't have to repeat these again, things of that nature. That is gone. It's gone. And unfortunately, I know this firsthand just recently. I had an ER doctor. Now, in pediatrics, here's what's really interesting. In pediatrics, the ERs generally are not staffed by pediatricians. There aren't pediatricians in there. And so ER doctors are very comfortable calling the local pediatrician of record for that patient to let them know, hey, your patient's here. This is what I'm seeing. We would like to do X, Y, or Z. Do you agree? Not. And this, when would you like to follow up? Right. Sure. So this was always happening. This has happened for years and years and years. Well, recently, it was about 8 months ago, I guess, six to 8 months ago. One of my patients went to a freestanding emergency room that was under an umbrella, large university umbrella, and the ER doctor was not treating my patient in accordance to what we know a patient should be treated like. And so the family called me. And when we had the discussion, the patient, who's a known asthmatic, she was having an asthma attack. She needed to be spiffed up, so to speak, get a breathing treatment in, maybe get some oral or IV steroids, get a treatment plan in place. They said they did a chest x-ray. They told mom that she had pneumonia, and that they wanted to transfer her to the local children's hospital for admission. The mother was like, okay, well, she has pneumonia. Are you going to give us an antibiotic? Crickets. She's an asthmatic. Can we get a breathing treatment? Crickets. So when I got on the phone with the emergency room physician, I asked those same questions. I'm like, well, you're telling the parents that, she has pneumonia. And they're like, well, and so are you going to give her, and I listed, the common antibiotics that you normally give a person for community acquired pneumonia. And she was like, well, we can do that. Like, yeah, I know, you're in an emergency room. That's usually what you do. Right. And then I asked also about a breathing treatment. I'm like, well, she's a known asthmatic, and, I don't know what her chest exam sounds like, but it sounds like she needs a breathing treatment. Are you guys going to give her a breathing treatment? Oh, no, we can't do that. So why can't you do that? They said, oh, no, we can't do nebulizer treatments in the ER anymore because they spread COVID. And I said, didn't you test her for COVID? Yeah, we tested her. And the result was negative, correct? Yeah, it was negative. Okay, and the parent told me that she had 2 previous at-home COVID tests that were negative. So therefore, she doesn't have COVID. Mm-hmm. So don't you think you should treat the patient with a nebulizer and give her breathing treatment? Nope. Not even an inhaler with puffers, with a spacer, nothing. This kid got nothing. And so I was frustrated, and I kind of knew what the responses were going to be. So I'm sure I was a little snarky, but at the same time, I said to the doctor, I said, hey, you know what? Let's do this. Do you agree to discharge my patient from the emergency room and transfer care to me directly She'll meet me in my office in 10 minutes, and I will take care of her locally. And if she needs to be transferred to the children's hospital, I'll do it locally, because the parents don't want to go all the way into downtown Houston, and we have local pediatric wards right here. So if she needs to, she could stay in her neighborhood. Okay. The ER doctor agreed. As a matter of fact, I repeated the question twice because I wanted to make real sure that everyone that was listening to this conversation was witnessing that this doctor was releasing this patient into my care. Mm-hmm. Now, this is common. This is what we do. Mm-hmm. Okay. As physicians, we have physician to physician transfers all the time. We give each other a report. We discharge the patient. Here we go. Well, although she agreed to this twice, she decided that she was going to strong arm the family. She called CPS on the family. She called security on the family. They were very rude and demeaning to her the minute they decided to transfer her out of that facility and give her to me. Then there was all kinds of excuses to stall the family because the family believes that there was something else going on where they may have been calling local authorities to actually arrest the family. And mom called me back and she goes, something weird's going on here. I don't understand it. And I said, just get out of there as quickly as you possibly can. Just leave. We've already transferred care. I've accepted care from her. Just get out of there as quickly as you possibly can. What we found out was, yes, CPS was called on the family. I got a call from CPS the following day. I mitigated that very quickly, and I told CPS this is ridiculous. Why is this family being reported for something that's a non-issue? This is basically, excuse my French, but it's a pissing match between two physicians. That's all this was. One physician was mad because I did not concur and I did not follow the protocol or the narrative that they wanted me to follow. And so therefore, not only did they call CPS on my family, but they reported me to the Texas Medical Board.
Well, that sounds fun.
Yeah, it's good times.
Did the girl get to your office?
Yeah. She got to my office. I treated her. I gave her the antibiotics. I gave her 2 breathing treatments, followed up with her 2 days later, and she was perfectly fine. She totally recovered.
And was there any complaint filed against the other doctor?
Yes.
Okay.
The family did report the other doctor because of their horrible treatment there. I mean, they said that it was like a light switch. Her attitude changed immediately. She became very aggressive, very demeaning, very condescending to them, bullying them. And luckily, when you're dealing with mama bears, you better watch out because mama bears won't really take that really well. And so this particular mom, tough as nails, and she was like, no, we're not playing this game. And she hustled out of there as quickly as she possibly could. And, they said that as they were coming to my office, they were looking over their shoulder because they were pretty sure that, probably the authorities were being called or something, because they said they were acting so strange and wouldn't give them discharge papers, kept telling them things like, oh, our printer is not working right, and so we can't give you your discharge papers. And the mom just said, that's fine. You have a portal. I'll just look it up on the portal.
Right.
So. Yeah,
that's what Riley's mom said, was that it took them 3 or 4 hours to discharge. And in that process, they were calling CPS. Yep. How do you protect your patients from a hospital like this? Do you just warn them away from that hospital?
Yeah, I mean, we have been trying so hard. I mean, we've set up outpatient facilities locally to try to take the place of urgent cares or ERs because of this horrible treatment, or lack thereof treatment, because this is really what's going on, is that there was a narrative started very early in the pandemic, and I know you heard it, everyone heard it. It was, if you're sick, stay home. Do not call your doctor, right. Which was ridiculous. I was on Facebook Lives going, I've never heard this before. Why would you not call me if you're sick? That's ridiculous. Call me. We are in the office. Please call us. Don't listen to this nonsense. I don't know what's going on. but this isn't normal. If you are sick, you need to get treated, and we are willing to help you. So,
Yeah.
that was my mantra from day one, square one. Is like, we are doctors. This is what we signed up for. Why are we cowering in the corner, sucking our thumbs and acting like the sky is falling? It's ridiculous. This is exactly what we trained for, right?
Right.
I mean, the whole irony of ironies is that doctors were going bankrupt during a pandemic. That's ridiculous. Think about how counterintuitive that particular statement is.
Well, everything seemed to have been built to encourage profits for hospitals and screw you guys over. Pardon the French. But for example, even like in the way Rick Bright handled hydroxychloroquine, right? It was only in a hospital setting. Well, that negates preventative measures, which is the purpose of it.
Right.
When I research some of these hospitals, and I won't name any specifics, but one thing I do encounter is non-Americans running the hospital. Now, you might think, well, this is an inclusive country, and I agree, we should be inclusive. A mixed race family, it's not about race, it's about American. And it's about, when does the quantity of hospitals with board members who are not from the United States, who do not have the values ingrained in them of United States citizens, when does that become a national security risk? How many people at Boeing are from Iran?
Yeah.
I mean,
and China.
Yeah.
I mean, I live in NASA territory here, right where I am. NASA literally is about 4 miles from my office. So we have the Johnson Space Center here. I have tons of engineers and rocket scientists that come to my office with their children. And so, I get it. I understand we're an international community. We have the International Space Station. I get that whole thing, and I think it's awesome. But on the other side of the coin, it's the culture of America. What is the culture of America? So my mother was an immigrant to this country. And so she was born in Belarus, Russia, in Minsk, Russia. And she was, her family was taken captive in the early 40s. And they were transported to Germany and put into a work camp. Oh, wow. They were not Jewish, by the way. And they were prisoners of war. So my mother was a child prisoner of war in World War II. Wow. During the Holocaust. And they survived, luckily. I mean, this was a work camp. So like work camps were concentration camps. It's just they didn't have the ovens readily available right there. But they had other things readily available. So, she came to America. I mean, she was lucky to be liberated. Her camp was liberated by the Americans. Okay. So in Germany, East Germany and West Germany, the difference was who liberated what camps, really is what it came down to. And my mother's family happened to be in a camp that was liberated by the Americans. Okay. So they asked the people in the camps, okay, would you like to go back home, or would you like to wait until you can get into America? And these people had been in these camps for years. So my mom was in a camp probably from 1943-ish, like between 43, 44 until 51. So there was no place for these people to go. So they lived in the camps even after the war. Like these camps were there because where are you going to put all these people, right?
Right.
And we're talking, hundreds of thousands of people in Germany that were not German. So when their ticket came up to come to the United States, believe me, they were probably licking the ground when they got here, Yeah. Very grateful to be here, grateful to be alive, and immediately assimilated into our culture. My mother had a Brooklyn accent, not a Russian accent, okay? Because she got to America and immediately wanted to learn English. They started working here in the United States, very menial jobs. My mother cleaned the floor of the tenement building in order for them to live in that in that small apartment. Mm-hmm. And I think there was 8 of them in one apartment or something of that nature. And so, they were so grateful to be here. They didn't care. They were going to scrub the floor for the landlord just because it was barter for them to live safely in an apartment together and have food and have clothing and have shelter and have, most importantly, opportunity.
Right.
And so that is something that is lost on some of our immigrants that are coming into our country. They don't believe in assimilating into our Christian, Judeo-Christian culture. I've said this over and over again, even in medicine, that my concern was that some of these doctors that are coming in specifically from countries that are non-Christian countries, is that their ideology of sanctity of life is very different than Judeo-Christian beliefs systems of sanctity of life. And I think because my thought process is that you cannot teach sanctity of life, right. It's not something that can be taught. And especially if you don't want to be assimilated into our culture, it's even harder. Mm. And so now we have a subset of our culture that has held on to their culture in a different country and is trying to bring them to our country and practice these things in our country when it's not appropriate. And right. So that causes ethical dilemmas like up the wazoo in the hospital. I mean, I could tell you, and I understand I do understand it because I trained in third world countries. So I was in a third world country when I trained. My mother, like I told you, she was an immigrant. She saw people dying all the time, right? So her idea of life and death was very different than what sometimes we as Americans think of life and death, right?
Sure.
And so, but at the same time, we should respect human life. We should respect the culture of the Americans, because if we stop doing that, we're going to stop progressing. In my viewpoint, that's just how I feel, is that we're going to lose America because we're no longer being American.
Right. We're eroding our soul. So,
yes. And we're the scary part is how do you do that? Right. You do that with the kids.
Right.
So I'm very acutely aware of this because of how I was raised with my mom, right? And I distinctly remember her saying to me all the time, even when I was 6, 7, 8 years old, never forget. Mm-hmm. You can never forget. I have to tell you these stories so that you never forget. You never forget. I mean, it gives me chills just to say that, but I remember my mother sitting us down at the dining room table and telling us, you can never forget, because you will lose America. You can never forget. And I just, I grew up with that whole idea of being grateful, that the American GIs saved my mom and our family. And it was always this, I mean, even to this day, if I see one of our service members in uniform, I just tear up. I can't even speak. I thank them for their service. And it's just, I'm tripping over myself if it happens to be in a restaurant or something to try to pay for their lunch or whatever, because they saved my mom. It's just the attitude of gratitude, and it's such a small gesture for me to pay for their lunch, for right. instance, and to show how grateful we are, because this is getting to be across our nation. Our military is being completely dishonored. Right. Our sanctity of life is being dishonored. Our children are being,
they're being subjected to horrible things.
Yeah, I saw a very, very disturbing story about something that happened in Dallas, and I think it was last weekend. But
the drag queen thing.
Yes.
Where the mom was saying the little boy was gay, and he was like, "I'm not gay," to a bartender or something like that. I can't.
It's just,
what are these kids doing there?
Exactly. Why is this? First of all, what are kids doing in a bar? Okay, this is not a restaurant. This was a bar. Okay, that's number one. You don't bring kids to a bar. Number two, what was the activity going on, and why did it have to be, quote unquote, family friendly? This is ridiculous. This is an indoctrination. This is pushing the 1% down our throats. 99% of Americans are not living that lifestyle, but yet we have to choke it down every single day. I'm so sick of it being thrown in my face. I don't care what you do behind your doors.
Right.
Your bedroom is your bedroom. Your life is your life. Live and let live. I don't care, but do not shove it down my throat. I am sick of it because it is at the point now where we are trying to convince people to be something that they're not. And then they get convinced that they're somebody different. And, oh, well, that's just, fostering who they are. No. That's manipulation.
Yeah.
That's not
you need to be
fostering
more
who they are.
inclusive and all that. Look, I'm great. Even I even speak to my gay friends. And I'm like, what's up with all this trans stuff? And they're like, we don't know. And even they're confused. Like their movement has been hijacked.
Absolutely.
And it's super frustrating. And most of us are stumbling over ourselves trying to explain why we don't want our 5-year-olds to have gender identity confusion from being exposed to confused identities. Like Jenny or John.
These children don't even know what their belly button is, for crying out loud. Why in the heck would they know any other body part? I mean, at that age, it is normal for a kid to be kind of what I would consider almost asexual. I mean, girls know they're girls, boys know they're boys, right? Because it's a label that they understand, but they don't really understand the sexuality part of it. They just know that gender part of it. Like, I'm a boy and you're a girl because I have this body part and you have this body part. And that's what is wrong with the fact that we have, a definite gender. Like, what is the problem with the gender? I don't really understand why we have to have this this ridiculousness of, the pronoun thing really drives me.
Yes.
I'm a pediatrician. Let me tell you something. This is shoved down our throats so badly, and it makes my blood boil. I'm going to start to stutter because I get that mad about it. But when you're looking at these crazy pronouns, right? And some of these people want to be a they, there, or whatever, or something like that, right? A they, there. That's a psychiatric disorder. That's called multiple personality disorder. That's
right.
A problem. That is a major problem. That is a psych disorder. So why in the world are we embracing the fact
and celebrating it?
Well, we were taught in medicine that you do not foster a delusion. You're not supposed to do that as physicians. We're not supposed to do that. We are supposed to try to stick to the facts, get to the core problem, and also try to steer them where the reality lies and not foster the delusion. And this is exactly what's happening. There is no such thing as a single person standing around and calling themselves they. It doesn't make any sense.
It's navel gazing. It's obsessing about your own little thing so that you don't pay attention to society, which we all are supposed to be contributing to.
Yeah.
But this contributes to destruction.
It's a very egocentric thing, and it's a very problematic thing because no one, and then they get upset with you because you can't understand okay, so you have this, I saw this wonderful thing. You probably saw this too. It's a video of a woman. I mean, she's an XX chromosome. She looks like a woman. She sounds like a woman. She's a woman, but then she's like, I'm fluid. And it upsets me when people think I'm a woman. And I'm like, because you are a woman. Like, I don't even understand this whole fluidity thing.
Why is this even an issue?
Well, why is it even a thing? Like, what is this?
Who
I don't even know what this is.
And that's an example of a person who probably had that put in their head from somewhere else.
Again, that's a psych disorder.
DSM-4,
so people
right?
that have post-COVID are not psych, but these people are psychiatrically deranged. I'm sorry, but it's true. They need psychiatric help. And we're seeing that this is a fad. The whole trans thing was not even a thing 5 years ago. I mean, I could tell you in my practice, I've never had a problem with, I'm not going to say I didn't have patients with gender identity issues, and I don't think it's gender identity. It was more like sexual orientation issues, right?
Right.
Do they like girls? Do they like boys? Whatever. Are they same sex? Are they, opposite sex? Whatever. But the thing is that's kind of almost that's a natural thing for kids to understand, because if you think about it, children that are about 10, 11, 12, 13. So they're in that middle school age group. That middle school age group, you know, you have girls that are holding hands with girls and arm in arm and girls. It's not because they like girls like in a sexual way. It's because that's a normal developmental process.
Sure.
That is who they bond with, because boys are icky at that point, which is a good thing, I think.
You know what? I live with 3 girls right now. You guys are a lot grosser than the marketing puts out.
I know. I have 3 girls myself, so you're preaching to the choir, and they're all teenagers right now. So, but that's what I'm saying. You know, it's like that age group. They're supposed to be icky, and they're starting to, you know, closer to 13. They're starting to understand. Oh, wait, I'm attracted to, you know, whatever. But again, some of that is suggestion, right? Because these kids, we know that kids in middle school, they're just downright cruel, right? They're mean, they're mean-spirited, they're ugly to each other. I mean, I'm constantly redirecting my children and saying, please, you know, watch what comes out of your mouth. That's not appropriate. You know, that's not nice. Be nice. You weren't brought up this way. That's not Christian. Come on, let's love each other and be respectful. You know, you don't have to, you have to be civil. You don't necessarily have to like the person. You just have to be civil to them. You know, like, where did the golden rule go? It went out the window like about 5 years ago. And the sad thing is that now we have everyone getting offended by things that are non-offensive. And so no one really knows what's offensive anymore, because everything's offensive. Right?
Yeah. No. And look, if anyone that knows me, and this is why I think a lot of my old friends are completely confused about this new life that I have, where I say these things that seem very conservative, is because I am very offensive. And the most offensive part about it isn't that I say offensive things sometimes, it's that I repeat them and enjoy it. Because I love the old comics, right?
Right.
The comedians like
Eddie Murphy. He was horrible.
Yeah, but even like Don Rickles. I saw Don Rickles for one of my birthdays. That guy would insult everyone. Norm Macdonald, also really funny. I mean, we lost our sense of humor somewhere along the way.
We have. Because PC has come in, and PC is communism. When you start to be you know, all this PC stuff, you know, oh, we have to, you know, really be sensitive to how we, you know, regard another person who is of the initial yada blah, you know, A through Z, pick one. It just doesn't make any sense to me. Like, I just don't even get it. You know, the whole idea, we're human. We're supposed to make errors. We're supposed to pick out things. We're supposed to be funny about, you know, differences. I mean, that's what made America great. I mean, yeah, there's issues, you know, but like, I grew up, so my last name's Italian, and my dad's mother was an immigrant to the country. So I'm a first generation on one side and a second generation on the other side. So, I mean, think about it. What did they call Italians in New York? I mean, because that's where my family was. They were in New York for a while, and then they migrated into New Jersey. But what did they call them? They called them guinea wops. And, you know, wop is without papers. That was their slang term for these people. And so, you know, that became a negative connotation when it was a fact. It was kind of like a factoid, like, oh, there's a wop. You know, that's how they kind of pointed out people from another country.
What is what is the guinea part?
I don't really know. That's what they called Italians, were guineas. I don't know. But in New Jersey, I mean, that's a I guess you would call, it's not slang. What do you call that now? Bigotry, I guess. I don't even know what the heck you call it, because, you know, we called it slang.
All, we would like to apologize to anyone who does not identify as a guinea wop.
Guinea wop. Yeah. We also use terms like Guidos. You know, that was Italian men.
Oh,
we
yeah,
called them Guidos. And the girls were Guidettes, you know, that had hair up to here, and, you know, the whole idea. So, you know, we had all kinds of terms for people, you know, that was just, you know, what we did.
I think it's a requirement in New York.
Well, I was in New Jersey. So
oh, well, yeah.
I grew up in New Jersey. I was born, bred, and fled. So,
okay.
When you're talking about, I understand your conflict, right? Because in New Jersey, I was fascinated by people's heritage because New Jersey is very heritage mixed. This is where people came in from Ellis Island. They found their ghetto, and I'm talking about the real term ghetto, not the negative connotation ghetto. So a lot of our language has changed, like the meanings has changed for these words, right? And so I used to love this. We also call this Jewish geography. See, again, another term that we use. And that's basically because you always want to know where someone's from. So if someone told me that they were from, let's say, Kearney, New Jersey, okay, then I knew without even telling, I didn't even need to know their name really. I could tell that they were either going to be Cuban or Italian because that's where the ghettos were. In Perth Amboy and South Amboy, in Elizabeth, parts of Elizabeth, they were Polish. They were also Portuguese. So, we just knowing where someone was from, I could kind of guess what their heritage was.
Yeah.
And so I found it fascinating that in New Jersey, like we had true ghettos, like towns were like ghettos. Like if you were from Spotswood, you were probably Hungarian. Like that's just how it is. Yeah. And so, because people like to stay with their own, especially when you immigrate to a country, you don't know the language, you don't know the culture, you're going to go where your people are, you want to find your people. And so this is what happened in the Northeast. And so we didn't see it as racial. Like I didn't even know what Hispanic meant until I was in college. This is embarrassing. Like I'm pretty intelligent. So like, because of the way we were brought up, it was just like, this is heritage. This is not a negative connotation. Like, nowadays it's like this race thing, like race hate or whatever they call it. Right. And of course we had bigots, right? But bigots was kind of the same term that you're talking about. It's like the sense of humor, making fun of everybody, using the slang terminology, that kind of thing. There were people that were true bigots that were just total jackwagons about stuff, but we have lost the beauty of what made us the great mixing bowl of the world, right? We have now made it that it's more important to be separate and divided than mixed all up together in a conglomeration and together.
Well, if you want to destroy us, we have
to get back to that.
I feel like this is all part of, unrestricted warfare. Mm-hmm. These are external forces that have manipulated our system financially and racially and even generationally. Mm-hmm. So the olds hate the youngs. Okay, boomer, and all that crap. And then you have the left hating the right, and it's all stirred up. And it's really unfortunate because it's using our news and our media in many ways to do that. CNN is the most disgraceful thing I have ever seen. I'm so sad to say I used to work there. And I loved it when I was there. It was fun. It didn't pay anything. But,
CNN was like, when CNN first came out, I think they were also the first 24-hour news channel because it never was shut off in my house. My mother listened to it 24/7. Yep. I'm not kidding you. She was fascinated by the news. And I cannot even get over how horrible the bias is and how blatant it is and how discriminatory it is. And, my husband and I, we watch, we really try not to watch any television, to be honest with you, but we actually watch the main networks so that we know what not to believe. I know that sounds ridiculous, but we want to know what they're saying so that we know that we believe the opposite.
Well, you want to know where the programming is. Like
that's what it's about.
The literal, what are they trying to program us with? And that's when you know what to oppose.
But every once in a while, they give us a glimpse, like in November of 2019, they gave us a glimpse, on our local station, they said 10 people in a province in China have a SARS-like virus. And I turned to my husband. I mean, I caught that like instantaneously. I caught that and I turned to him and I said, something's up. And he's like, what do you mean? I said, something's up. Why do we care about 10 people in a country of like how many billion? And he said, oh, good catch. And I said, we are one plane ride away from disaster.
Mm-hmm.
And so if this is true, because at the time, SARS and MERS and Ebola and all that fun stuff that was happening off our shores sounded absolutely horrifying and horrible. I'm sure it was, right? Because again, you're dealing with something you don't know what you're dealing with. And unfortunately, now we don't know what to even take seriously. I mean, there's some of us that are so skeptical about everything that I don't even trust the weatherman. I mean, not that they're the only people that can get their job wrong 80% of the time and still get paid. But
now the CDC can do that.
Oh yeah, that's true. I'm sorry. That's true. They make up their own rules. But this is kind of the issue that we're dealing with, right? We're being manipulated on so many different fronts, and on fronts that used to be trustworthy or somewhat trustworthy.
Right.
Right? So let's go back to medicine. Sorry, we went on this horrible tangent. But back in 1999, I was working at a large hospital system as an attending, and rotavirus recall came through. Rotavirus is one of the vaccines that we give small children. It prevents vomiting and diarrhea. In third world countries, it kills kids because of severe dehydration. So my job was to go to each refrigerator on each floor on each ward and make sure that there was no rotavirus in the refrigerators because it was being recalled. We found out that it was being recalled for something called intussusception, which is a telescoping of the gut. Okay, so the gut kind of telescopes on itself. It's very uncomfortable. It's pretty easy to diagnose. It sometimes self-resolves. And if it doesn't, it's pretty easy to reduce and, make it go away and it's fine and the kid does fine. Okay. It is not deadly. Okay, this is not something that's deadly, but it was something that they saw was an association, and they thought, you know what, it's better to pull this thing than to have any more babies suffer. Okay, and it happened to have happened in what we call a step-down nursery for kids that are newborns that are pretty ill. Okay, so I'm thinking back then, and even as I think about it back then, over the years, I remember thinking, oh, that's awesome. Like, look at how quickly they jumped on this because they really care about the safety for our kids. That was my attitude, honestly. I walked around, I was like, I'm so grateful that they caught this, because we didn't see any cases, of course. This happened, isolated, but we were following the rules. We took everything back, and I distinctly remember, gee, I wonder how long it's going to take to figure out, like, did this really cause this problem, whatever. Well, I could tell you, rotavirus was not reintroduced as a vaccine for about 5 more years. So the company had to go back and prove that their vaccine was safe and effective, right? So they had to prove that the intussusception really was not due to their vaccine, which ironically it wasn't. Mm-hmm. And it took them 5 years. Okay, so they saw an association, a possibility that it was a causation. They took it off. They did the epidemiology like you're supposed to. And then, repeat some studies, take a pause, and then reintroduce it when they have proven that it was not actually causal. So that, in my mind, right, as a pediatrician, I'm like, awesome. Okay, the safety valves are working, right? The switch got triggered. The signal came through, and they did what was supposed to happen. Now, fast forward to 2020, and within the first month of the release, I had a friend, I'll be honest with you, John. I had a friend who was one of the first medical people to get vaccinated against COVID in December of 2019. No, 2020.
Yeah.
2020. December of 2020. Mm-hmm. December 18th, I think, is when he got a shot. 16th, 18th, somewhere around there. He was dead on December 26th. And as soon as I heard of his death, I'm like, it was that stupid shot. Yeah, that shot killed our friend.
My pool guy.
And he was an anesthesiologist. The guy was brilliant. He was very active. And for me, it was heartbreaking because I knew what I knew. I knew the shot killed him. I knew it. I'm like, I heard all the dangers. We heard about AstraZeneca being paused in Europe for transverse myelitis. We heard about blood clots. We heard about it in all the shots. It wasn't just J&J. They just used J&J as a scapegoat, right?
Right.
But it's in all the shots. The clots, there's a reason why there's a group of people walking around calling them clot shots. It's because it causes clots. And we know this. So strokes are not normal in 40-year-olds. Most 40-year-olds will do just fine and never have a stroke, I'm pretty sure, right? I mean, I'm out of my 40s, thank you, Jesus. But this is really something that so deeply disturbs me, because the signal went up not even a month after they were, and sadly it was our hospital people that were dying.
Yeah.
The first people were the hospital personnel who were standing up and saying, yes, I'm going to do this because of our patients. They were doing it because they thought it was safe. They thought it was the right thing to do for their patients, because they're standing there. The sad thing is, my friend had COVID a month earlier and did fine. He had sniffles. He did fine.
We mentioned Coxiella a little bit, which I think may be a potential differential diagnosis that's been ignored. What do I know? I'm not a doctor, but I try to talk to doctors about things. But the thing about Coxiella is that there is a vaccine for it. And right on the label is very clear that if you have had Q fever, is what they call it. Come on.
Yes.
Come on. It's too easy. If you've had Q fever, don't get the vaccine, because you can have a severe reaction.
Yep. That is the reason why if a child has chickenpox, we don't give them a chickenpox vaccine. I mean, they have natural immunity. Because you have natural immunity, it sets you up for danger if you get introduced to a foreign substance that is resembling that particular disease process. Your body's going to attack it, and it's going to attack it for your sense. It's going to attack it hard, because your immune system, your native natural immune system, is robust. And so it's going to go crazy. That is why we're having tons and tons of problems with autoimmune disease in the last 2 years. I mean, it's a prediction or a hypothesis or a theory of mine. I don't know, whichever way you want to put it. But I am so concerned. And I said this back in 2020, with the masking and the isolation and everything, because in pediatrics, that's just, shutting down the schools was horrible. I have 3 kids. Yeah. Now, we were homeschooling at the time, so we're used to that kind of, we're used to being at home. We were being taught at home that our kids continued their education. It was kind of like business as usual at our house. But, for kids that depend on the schools as a sanctity, a place of sanctity for them, safety for them, in our own district, we are missing, and I say missing, thousands of children. We don't know where these kids went. Okay, so this is a big problem, because schools are supposed to be safe. Schools are supposed to be, where children learn things. Not be indoctrinated, but they should learn the basics. They have changed education. Education no longer is education. Education now is indoctrination, just like the brown shirts of Nazi Germany. Where did they go? They didn't go after the old people. They went after the young people. They molded them into being cold-hearted people who would throw their mom under a bus, literally. And so this is, and we're hearing these reports, right? I mean, remember during COVID, they were saying, well, if you have a neighbor that's not wearing a mask, report them. I mean, what? They were turning the citizenry into a bunch of Nazis. It was ridiculous.
I know.
I mean,
I was a jerk about it,
this is kind of the weirdness that we're dealing with. And no one sees it.
I was a jerk at the beginning. That was as jerky as it gets. Look, if you'd looked up the word COVID jerk in the dictionary of whatever, that was my picture.
Right. And so I was the opposite of that jerk, and I was trying to bring sanity. And I would say to you, if you were like, why are you, the whole mask Nazi thing, I'd say, well, if your mask protects you, why are you so worried about me?
Oh,
why are you so worried? Yeah. If your mask protects you, why are you so worried about me? And if you are that worried, lock yourself in your home, please. There's delivery services that will bring you your groceries. You don't need to be in public if that's the way you
Right.
feel.
I came out of it in June.
Honestly,
Yeah.
is how I talk to people, because I was like, this is ridiculous.
Right.
You do not have medical domain over me and tell me what to do with my health. You don't have, and that's what I kept telling people. I'm like, under what authority do you have to tell me what I need to do for your safety? It's your safety, my friend.
And you know, and my thing was mostly concerned for my family. And
Again,
I was like,
stay home and get your stupid stuff delivered. There you go.
Right.
You're done.
Right. And I was thinking, like, well, my parents are elderly. There's no one to take care of them if they get sick, and you know, and we were being bombarded with families dying.
Of course, you are from
hospitals.
California, so you're forgiven.
Well, delusion is a way of life here, dreamland.
Mm-hmm.
So, but you know, all of that went right out the window as soon as the protest began in June 2020, and no one noticed that all the studies discrediting HCQ were fraud. That just kind of got swept under the rug, right?
Right.
Once that happened, that was it for me. I was like, well, this is all garbage. All of this is a lie. And everything just, you know, the veneer faded
I'm so
away.
glad that you came to the light, my friend.
Well, I mean, I was right that something was coming. It was this mass hysteria, but I think it was also, maybe COVID isn't fake, but maybe it wasn't that bad, but maybe it was just bad enough so that if you take away all the stops, you can kill a lot of people with it, and then you can say that a lot more people died and create this hysteria. You know, no one ever acknowledges the fact that 7,000 people die a day in the United States.
Right. And that our death rate did not change overall in 2020.
I mean, I'd done a little look into that, and it did. There seemed to be numbers that kind of went down up, but you know, there was a dip in deaths because nobody was out riding motorcycles at 120 miles an hour and stuff.
Right.
Like
We
that.
had a little dip, but then what you saw towards the end is you saw that things like MIs and strokes and things of that were down because the numbers but in the same proportion, COVID numbers were up.
Mm-hmm.
So if you actually took your total number of deaths, is pretty comparable year to year. But what you saw was the distribution, the causal distribution was different. But when you started to look at the numbers, you realized, that doesn't make any sense. Like, why all of a sudden, when you're looking at heart attack rates that are pretty steady over a decade, now all of a sudden there's no heart attacks? Like, that doesn't make any sense, right? There's no flu. I mean, that was the most apparent one, right? To most people, they were like, where the hell did the flu go? Right. And there is something called viral suppression, though. There is something called viral suppression where when there's a predominant virus in the community, then other viruses do get suppressed. Like, we didn't see RSV. We didn't see adenovirus that much. I didn't see what I'd love to call the puke and poop virus. Didn't see much of that. Granted, because a lot of kids weren't in school, they weren't doing daycare, people were staying at home, you know, so your normal virus transmission thing wasn't really going on. I got that. I figured that out. But there were enough daycares staying open. There were enough, you know, essential workers still working, especially where we are. We're in the energy corridor. So, you know, we have oil and gas industry here. They had to go to work. They couldn't stop working. So we were in our area, we have a lot of people that were still going to work, like physically showing up to a workplace. And so, you know, for me, I have a lot of those types of people in my practice. I mean, those families come to me all the time and they knew I was open, but the incidence of disease was way lower. Now it shifted, right? Because kids were unaffected. So like if I stayed in pediatrics for those 2 years, I would have been bankrupt because kids were unaffected. They didn't get sick. I mean, they were breaking their legs, jumping on trampolines, you know, that kind of thing, but they were not getting COVID, and they weren't getting sick, and they weren't getting hospitalized, and they just weren't.
Right.
It was adults. And so I shifted to take care of adults because no one else would. Everyone was closed except me. And I'm like, this is silly. Like the university systems were closing down, and I couldn't understand. I'm like, why would you close your doors to your own people? This doesn't make any sense in their greatest time of need. And then all the weird stuff, like not using nebulizers because they spread disease. All of a sudden, we've been using nebulizers for how long? And now they're spreading of disease. Are you kidding me?
Yeah.
Do you know how transmissible influenza is, comparatively speaking, to COVID? And we use nebulizers all the time in flu season. That's ridiculous. And the other thing that gets ignored is the pandemic of 2017, 2018, which was the Spanish flu, right? So we called it the flu-nami. For those of us that worked it, I was seeing 60, 80 patients a day. It was crazy. And I'm talking about kids. They were sick. And I'm running around like a chicken with my head cut off for about 2 weeks nonstop. It was just insane. But what we don't ever bring up, or what I don't find people bringing up, is that it is estimated that we lost 95,000 people in that season. Now, it is not recorded the same way that COVID was recorded. Like every breathing human being was counted in COVID. In influenza, certain counties don't even report it as a reportable disease. Certain states estimate their numbers, based on CMS data and whatever. So, 95,000 was their estimate of the deaths from the influenza virus in a 4-month period. Think about this, 4 month. COVID is the illness that just keeps giving. I've never seen a 2.5-year season in my life. We don't deal with numbers the way we're dealing with them now. And this is the thing that drives me absolutely insane, when they were saying the ICUs are full and they thought we were stupid. They thought we were dumb. They thought they could scare us. And the first thing that I did, like, people would call the office. See, this is what got me in trouble, John. My patient population knows that I'm very forthright, and I'll shoot from the hip and tell them what I think.
Sure.
I know that's a real crazy thing right about now. But so they would call the office and they would say, hey, can you ask Dr. Farella XYZ, right? So I got these questions about when the media was screaming about how we were running out of ICU beds. Now, I'm in Houston, Texas. We are in a catchment area of over 7 million people where I live, okay? Huge area. We have the mecca of all meccas in downtown Houston, where our medical center is. We have, I don't know, 5 or 6 hospitals within like 3 blocks of each other. I mean, giant hospitals, not little community rinky-dink clinics. We're talking about giant hospitals. And people are like, Dr. Farella, the ICUs are closing down. I mean, they're just so full. They can't accept patients. They're on. And I'm thinking to myself, wait a minute, what are you talking about? Let me check real quick. Now, it's public record. All you have to do is go on this website, tmc.edu, went on the website, and I'm like, the ICUs aren't full. We're not even past phase 1. Now we have 3 phases of emergency, phase 1, phase 2, and phase 3. At that time, it was like June or July of 2020 when we had that kind of peak where they were blaming, Memorial Day and whatever. They weren't blaming the fact that there were riots everywhere that had thousands and thousands of people, spitting at each other in cold weather. They were more worried with us going into the beaches in hot summer sunlight where the virus dies at 75 degrees. But let's just forget about that small inkling of truth. So I looked at the tmc.edu website, and it showed us under phase 1 ICU numbers.
Yeah. And
so I did a video. I did a Facebook Live, and I showed people how to find the numbers. I'm like, look, stop panicking. Get your sources right. This is their source. Here's the direct source. Let me show you. I have my phone because I'm very not techie. And I'm like showing people, like, here's the website, and this is what you do. And here's the real numbers. I don't know where they're getting these numbers from, but these are the real numbers. Here it is right here. This is real time, blah, blah, blah. Well, within about 2 hours, I got an email because, I'm medical personnel. So I get emails from Harris County Medical Society, Texas Medical Association. Within 2 hours, I get this email that basically states that the Texas Medical Center person who said that we were in, ICU phase, that the ICUs were filling up, misspoke.
Right.
And it was just an odd coinkydink.
Yeah.
That that particular video went absolutely viral, super duper fast. And I didn't even know what viral was. Okay. At the time, like I was lucky if 200 people watched my videos, honestly. And
No,
then
me
all of a
too.
sudden,
Yeah.
like tens of thousands were watching this within minutes, right? It was being shared and shared and shared and shared. And that's when people started calling out the crap. They're just like, this is BS. You know, here it is. Look, this doctor knows what she's talking about. And I didn't even think I was being controversial. I was just trying to show people, like, stop your panic. This is how you find out for real. Find out for yourself. Here it is. This is how you do it. So that was the beginning of my censorship. Right after that, I started getting censored like crazy. And honestly, I didn't even realize it for a few other months. You know, it took me a couple months to finally figure out that I was being shadow banned or censored or whatever you call it. Because again, I'm not that savvy. And I was like, no one really cares what I'm saying anyway. You know, like I'm not that important. Like, who am I? I'm a fly on the wall. So,
well, yeah, I don't get a lot of viewers. I'm not doing this for viewers. I don't know if maybe what I'm doing is a historical record so that the kids have something to look at and go, what went wrong? And it's like, well, Daddy will tell us. Cue the videos.
That's exactly right. That's why this is the hill I'm going to die on. I mean, I tell this to people all the time. I'm not doing this for me because I don't care about me. At this point, I'm on the second part of my life, and I've had a great life. And you know what? I'm doing this because you should never forget. My mother told me never to forget. I mean, such a time as this is when I was born for, right? And I will not. I am relentless, honestly, in this, because this is wrong. Like, wrong is wrong. Killing children with an investigational injection is just downright evil and wrong.
Yeah, you know, when they say it's fully approved and the FDA says it, it really makes me mad.
It does.
It's fully approved. What's wrong? Dude, it's a fully approved for emergency use, which is way different than a fully approved and tested vaccine, which takes 10 years and $100 million. Conveniently.
And, you know, there's so many of us. The irony of ironies is, I told you I've given out tens of thousands of vaccines in my career, tens of thousands. And honestly, other than local reactions, I've had zero adverse events.
Yeah.
Anything serious, you know, minor stuff, but nothing serious that I felt like I had to report, you know, to VAERS. I knew what VAERS was. I've never had to put a report in until these vaccines rolled out. And it's like almost immediately I started to get, because of my open mind, and I was willing to do things that others weren't willing to do. We were getting calls from all over the country. Dr. Farella, you have to help me. I got this, and I don't know what's going on with my body. It's going completely haywire. No one can help me. Everyone's telling me I need a psych diagnosis. And I'm telling you, I'm recording my blood pressure, and it's up 1 minute and it's flat down the next minute. And, you know, I feel like I'm on fire. Like, I was getting all these crazy symptoms, you know, and it's like, there's no way. And one woman who called me from Kansas, you know, I'm in Texas. She calls me from Kansas, and she's an elderly woman. She was a nurse. She was meticulous in her record keeping of her blood pressure and exactly what was happening to her. And it was just, there's just no way. There is no way that you cannot attribute this to when she got that vaccine. There's absolutely no way. And the things that were coming out of her mouth telling me what's going on in her body, I was flabbergasted. And I'm kind of hard to shake. And I'll tell you what, my mouth was open, and I said, honey, I don't know what I can do, but I'm going to try something. And that's what I did. I just tried something, you know. I'm like, I don't know if I can help you, but let's see if we can do something. And that is really where I started to get really worried, because now we're in a whole new realm of medicine. And it's a realm that none of us trained for. It's a realm that none of us know how to even start to tackle. I knew from day one, square one, this was a bioweapon.
Yeah.
And how do you combat a bioweapon? You know, there's people that know what they're doing, but we're not the ones that know what they're doing. And so we're the detectives, like trying to put the puzzle pieces together and trying to figure out, well, we think this may have been the mechanism of action, so therefore our treatment should target this, but we don't know if it's really going to work or not, you know. And it's the same with COVID. Why do some people get a small cold and other people are like dying, you know, or why is it that some people recover fine and then about 2 or 3 weeks later, all of a sudden these weird things start to happen to them? Like, you know, contortion of their muscles or twitching, or, you know, what we call myoclonic jerks, where their arm just flies, you know, off the table, and they didn't try to do that. It just happened. You know, where children can't feel their legs, you know, stuff like this is happening. And we're like, where in the world is this coming from? And what is it? And how do we fix it? Because that's what I care about, because we have so many injured people right now.
Yeah.
And the docs that really want to restore the patient-physician relationship, the doctors that want transparency in medicine, you know, medicine and research go hand in hand. And I was taught when I trained, I had to do research when I trained, and they said, look, don't worry about the outcome of your research. The important part is, one, that it's done, and two, even if it doesn't come out in a positive way, that's still important to know. You know, whether it comes out positively or negatively. Yeah, that's how I was taught.
Yeah.
And unfortunately, I'm telling you, this all switched. It's really weird. It all switched probably in the early 2000s. Really is where the attitude, I noticed, like the residents' attitudes were switched, and just their non-benevolent behavior, for lack of a better term, you know, it started to really bother me that, and I thought it was because they were being handheld. Like I thought it was, they're being, you know, fed with a silver spoon type of thing, you know, like the residency programs changed quite a bit, and things were happening where, you know, we were the old boy school where it was like we were up for 36 hours straight, and then we had to go home for 6 hours and come back and work another 24-hour shift. Like that is what I did for 3.5 years. Like my life was not my own. Okay. And that's okay. I mean, I was used to working 110 hours a week. I mean, that was normal for me. So when you're now going backwards, you know, the people that are being trained now, our concern is, are they being exposed? Are they being stressed? Because it's really important for a physician to work when they're exhausted and understand and think clearly and think under pressure and think and do the right thing. We're not just, EMRs have made us check, you know, box checkers, right? So tick this box, cross this T, dot this I. What is flashing in front of you, you know, that kind of thing. It's no longer like, hey, this is a patient in front of you. This is their symptoms. Do your exam. These are the signs that you're seeing. Put it together to get an assessment and a plan together. Yeah. It's not that anymore. Now it's all protocol driven with the EMRs, and this was part of their plan. You're right. This is a Hillary care thing. Epic is a Hillary derived brainchild. I mean, we know this, okay? This is not secret information. This is very well known that she is behind a lot of Epic. Okay? And so when you're sitting here going, why are politicians so engrossed in what doctors are doing? Why are they so engrossed in controlling what we're doing? I never thought I'd wake up in the year of vision, right? 2020 was supposed to be the great year of vision. At least for me. That was going to be my great year of vision, right? And lo and behold, it was a great year of vision, wasn't it? Like,
sure.
I had to look back.
We didn't like what we saw.
No. I mean, hindsight is 2020, and there it was right there. In 2020, you either had hindsight or you didn't. And that's what I found out. I found out real quickly who were my friends and who weren't my friends. Well, actually, I found quickly who weren't my friends. It was really hard for me to find out who were my friends because we were so isolated from each other. You couldn't have a conversation with somebody, another physician, without them chopping your head off and telling you you're a heretic. And you're like, right. No, this is like, shouldn't we think about this?
Right.
Like, shouldn't we put this together? Like, one of the aha moments for me, honestly, was when, I think it was It may have been Fox News or something, but they showed the world map. See, again, remember I told you they give you like these weird glimpses of little information they don't really want us to know, but then they show it to you. And the people that are smart enough to pick up on it really go, boom. So it was a world map of where COVID was most prevalent, and then a world map of where malaria was most prevalent. Okay. And then they superimposed the maps. And interestingly, what you saw is where there was malaria, there wasn't really much COVID. So my deduction was, okay, is that because malaria occurs in very poor countries where there's probably not testing, it's probably not great medical care, and maybe it's a numbers game, maybe it's a stat thing, like maybe people do have COVID, but they don't know it. But then also, my other thought was, okay, we know that people in endemic malarial areas have sickle cell disease that protects them from malaria. So that tends to be darker skinned individuals. And maybe their sickle cell protects them from getting COVID. That was another one of my brilliant ideas. And the third conclusion I came to was, well, maybe they're on something to prevent malaria that also is a prevention for COVID. Ding, ding, ding.
What could that be?
I
know. Hydroxychloroquine? Right? Yeah.
Or Malarone. So, so that's when I did the deep dive, because I was like, okay, what do they treat malaria for? And then I was like, well, duh. I mean, I have missionaries that leave all the time for Africa. What do I write for them? And I write chloroquine for them. Mm-hmm. Well, I did, and then, or hydroxychloroquine, right? So I was like, oh, this is easy.
Yeah.
And then I'm like, well, hydroxychloroquine, they use that for rheumatoid arthritis. Oh, this is easy. It's readily available, because that was the other thing I was worried about. Like, is this stuff not very available? Because we used to think that we had to send people to traffic clinics to get their stuff. So anyway, that's my little discernment. That was where my brain just kept starting to tick and go, wow, this is really not that hard to decode if you're paying attention.
Yeah. Well, now here's an interesting thing about that map. That map is also where it shows COVID. Would also be similar to a map. Well, the inverse of that map would be areas that do not have prevalent Coxiella outbreaks. The United States doesn't have any sort of immunity to Coxiella. United Kingdom, Canada. I think it originated in Australia, Queensland. But New Zealand also, no Coxiella. And I thought that was curious. And then what really made me go, gee whiz, boy, this makes me wonder a lot of crazy things. I'll show you. This is the CDC's website for Q fever. And it's all nice. There's goats. Comes from goats a lot of times. You can learn all about it, how easily it spreads. 10 miles on the wind. So that's not scary. But then there's this little thing right here for healthcare providers. Super high fever. Yeah, we had a lot of that. Mm-hmm. Then you get down to... There's doxycycline. Well, that's an interesting treatment. I wonder who came up with that. Then you get down to record scratch. Considerations for intentional release. Why is this on the CDC's website? It's a highly infectious agent resistant to heat, drying, and many common disinfectants. It can be aerosolized, and inhalation is the primary route of infection for people. Just 1 to 10 can make you sick. But this is the money shot right here. This agent has been previously weaponized for use in biological warfare and is considered a potential terrorist threat.
Isn't that something?
And the World Health Organization tells you that if you spray 50 kilograms of C. Brunetti over an urban area with 500,000 inhabitants, you would have 125,000 cases of acute illness, 9,000 cases of chronic Q fever, and 150 fatalities. chronic Q fever, long haul Q fever.
Well, if you look at this also, I happen to do a lot of work with PANS and PANDAS, which is the pediatric autoimmune neurologic diseases secondary to infectious agents. So this parallels that as well. I mean, what do we treat with? We treat with a cocktail, doxycycline, or I tend to use minocycline because it's a little easier on the kid's stomach. It parallels tick fevers, right? So it parallels a lot of stuff where, when you start thinking about, because I do PANS and PANDAS and I do Lyme's, I'm from New Jersey. So, Lyme disease was really prevalent there. My mother had it. My brother had it. My sister had it. Our dog almost died from it, so I'm pretty well versed about Lyme disease. And, there's theories about Lyme disease being a bioweapon, that it was introduced to our population off of the state of Connecticut on a small island that was doing research. And they believe that these ticks were released infected with this organism that caused this disease. And, I remember in my childhood that, when someone was diagnosed with Lyme's disease, it was very, very heart-wrenching. Right. I mean, these people had severe neurologic outcomes. Many of them died. There were some suspicions of triggering cancer tumors, things of that nature. And so, when you have a bias where it's so hard to get people help if they have the diagnosis of Lyme's disease, and here we have COVID, and the long haul acts exactly like PANDAS and post-Lyme, chronic EBV, which is chronic mono, chronic mycoplasma, which is a lung disease. These things are all in parallel. This is not by accident. This is not, and it starts to make you start to think like, okay, are these all truly different diseases, or are these just derivations of the same disease called something different? And so depending on who you listen to, it sounds outrageous, but the other night they were showing the monkeypox thing on TV. Again, small glimpse of the truth showed up on the evening news, and they were showing blood splotches, like what blood cells look like and stuff. Now, I'm no hematologist, but I did take a lot of histology and microbiology in school, and I had my husband stop it. I'm like, stop, rewind, stop. And they were showing, normal red cells and then what the monkeypox looks like. And if you stop on that particular scene on the evening news, there's spike protein all over that cell. It looks exactly like coronavirus. So maybe I'm a conspiracy theorist, but is monkeypox not just moneypox? Is monkeypox smallpox, or is monkeypox just coronavirus in a new form? I mean, what the hell is this? So, and then there's, that interesting SV 40, 80, 90, whatever it is, the simian virus. Yeah. That's kind of, that was a new one on me, but hey, why not? I mean, there's, what the heck else? I mean, these are things that are just so outrageous.
I have to show you this because I don't think we talked about SV40 in a show the other day with Jenny Porter. Because every time I think I've seen all the crazy things in the world, God shows me that I'm completely wrong. This, Dr. Mary's Monkey, is a book about SV40 and how it was used to become a weapon in gain-of-function research in, no, not Ukraine, no, not Iran, Iraq, or Pakistan. No, they did it in New Orleans in 1963. And the part that's extra crazy is that I guess what they were doing was they were bombarding lab rats that had SV40 cells injected in them, and they were bombarding the tumors with radiation to create variants. And then they would inject those variants into monkeys to see which ones would die fastest. Is that... Or somehow that... Forgive me for not understanding the biological process for gain-of-function research using particle beam radiation. I don't want to know. But They were doing something with this, and then they were injecting the things, and it was disaster.
And it was worse, right? And this is exactly what a lot of us that are part of the Global COVID Summit, like the real one, not the one that the administration just decided to mimic, steal our name. But we're really concerned about this because we're thinking just based on observation, right? And once upon a time, not too very long ago, observational studies were an actual thing. And it was based on clinical study of a patient or an observation that you're seeing. I'm a trend watcher. I love to watch trends. I like to predict trends. And unfortunately or fortunately, I'm actually kind of good at it. And so it's a lot of common sense to me. Like I'm not one of these people that likes to cite articles, and I'm a pediatrician. We don't really do that whole thing. Sure. We do a lot of clinical stuff. So, watching a kid grow, like my expertise is growing a kid, right? I mean, that's really what I do. And so I have this keen sense of observing changes and things that are out of the ordinary over 18 years in very different phases of life, right? And growth and development. Mm-hmm. And so I think pediatricians should have a heightened sense of awareness with the whole COVID thing, but sadly they don't. And unfortunately, I'm very concerned because we have heard over the last couple of years, again, the normalization through the news media that, certain disease processes are on the rise. Certain things are happening. Like this is the first generation of children that will not outlive their parents. Like that has been drummed into our heads over and over and over again because of the reality that our children are obese and very undernourished, or what I like to call disnourished. It's not they're fat, but they don't have the nutritional wherewithal to sustain. And it's also causing chronic problems, hypertension, cholesterol problems. When I trained, we never trained about cholesterol medications in children. Like that was not a thing, not at all. And so, in the last, again, 5 to 8 years, we're hearing more and more about, putting kids on hypertensive medicine. Well, the only kids that we would put on hypertensive medication were kids that had renal disease or heart disease. Like they were born with that. So they had to be on that medicine, not like a normal kid or who was born normal. And then because of the fact that they're obese, now they have hypertension. And so now they need to be on these meds. Like this is ridiculous. This is such a blasphemous thing in medicine right now, because we as pediatricians, we're preventive care. That's what we do. We grow kids, we prevent things. Obesity is preventable, and it's preventable by education. And unfortunately, too many people have taken the back burner. We have, people that have too much access to garbage. They like to say it's because in poor communities, they don't have supermarkets. That's the biggest bunch of crap I've ever heard. I mean, I've lived in the crappiest neighborhoods throughout. I mean, I was a poor medical student for a lot of years. You know what I'm saying? So I lived in a lot of bad neighborhoods. And yes, we had supermarkets, I promise. Now, did you choose the right foods? That's a different story. Did you have electricity in your home and maybe you can't cook? In the Northeast, all of our stoves and stuff are electric. Down here, they're gas, so it's a little different. But, so there's other socioeconomic issues. I get that. However, overall, what made the 2010s and 2020s different from 1980s and 1990s and 2000s, right? That now we're saying that our children are going to die before we die because of obesity, hypertension, type 2 diabetes that will then occur as type 1 diabetes and all this and all the horrible issues that are associated with long-term diabetes. So how do we curb that? Well, it's called educate. I mean, just do your job. Like teach parents how to feed their kids. I mean, it's really not that hard. That's part of my 6-month well child check. Every single person that comes in with a 6-month-old, here's my lecture. And then I do it again at a year. And then I do it again at 2 years. And then I do it again at 3 years. And then I do it again at 4 years. I mean, this isn't hard, It's just, again, it's the stupid tick this box, tick this box, tick this box. And we've forgotten to do what we're supposed to do. We've forgotten what we've been trained for. So this gain of function, we're doing it even scientifically. We're doing it socially, right? Because we're causing bad disease in our food. I mean, think about when, I tell people this all the time because I graduated high school in 1987, so that's pretty sad. But in 1987, there was one McDonald's, and it was 2 towns away. And so it was a huge treat if my mom decided that she was going to drive us 2 towns away to go to McDonald's.
Yeah.
Now there's one pretty much within 3 miles of, like, every McDonald's, there's at least one every 3 to 4 miles, depending on where you are. Like in Houston, there's a fast food restaurant.
Yeah.
Probably 10 in 3 miles. Seriously. So, and then I tell people this all the time too. Next time you drive through a drive-through at a fast food restaurant, what is the first sign you see? I'm going to challenge you for that because you probably, if you don't think about it, you won't really know. But
probably the combos.
Nope.
No? What is it?
Dessert.
Oh.
It's usually desserts. It's usually like, their apple turnover things.
Oh, yeah.
See, I don't ever go through a drive-through, so I don't even know.
I think they're appealing to the stoners.
But I mean, it's usually desserts. It's like the fattening shakes. It's the smoothie. The slushies. It's it's that junk. It's the junk. I tell parents, well, try to find a salad on a McDonald's menu. Just try.
Yeah.
It's non-existent, and if it is existent, it's so hard to find. You really have to read through all the different things to find it. It's designed that way. This is not. It's such a sham. The American Academy of Pediatrics is a huge sham. I dropped them in 2008 like a bad habit because they became so far left at that point, and I'm like, they do not represent me, and they don't represent my patient population, and they are not in my opinion, they were not providing what was best for children. Okay. And I said, I will not be a part of this national organization anymore. I said, I'm done. Back in 2003, 2004, I actually took a seminar that was called Media Matters. And what it was to learn how to discern the media for what its messaging really was trying to get across. Mm-hmm. Okay. Because this is at the time when they were saying you can't market to children, you can't use cartoons for children, cigarettes cannot have cartoons in them if you even advertise them, and then cigarettes could no longer advertise on the TVs and stuff like that. So that was that time. That was that era. When did that change? Because if you recall, not too very long ago, Sesame Street was promoting COVID vaccine policy. And if you actually looked at the television set, did you see the advertisements or the commercials
the
for
Fauci ouchie?
No. The commercials for COVID, like where to go and get your vaccines and COVID information. It was all cartoons, and the cartoons had a foreign accent. Did you ever pay attention to that? And they were like marching bands. It was the craziest thing, and I'm like, they're using cartoons to market to children to get this crazy narrative across to our kids, because our kids are so influential, and they will in turn turn on their parents, which I see that all the time, right? How many times have you seen, I mean, I've seen children in my office where the parents are they're over it. They take their mask off. Everything's fine. Like, we haven't had masks in our office for a very, 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 very long time. And so we encourage people to take their masks off. And there are still some children to this day that will not take their mask off, even when mom and dad tell them to take it off.
When 9/11 occurred, it's not exactly a change of subject, but just when it occurred, remember that when we watched it go down, everyone watched it, and the firefighters and police rushed into the buildings, and the buildings collapsed. And you realize, my gosh, if you were going for a loss of life, this is the way to do it. You make a disaster, and then if you understand how our emergency protocols work, you could exploit that and create even greater loss of life from the single accident. Mm-hmm. That's what, it was like, my God, they knew that they would run in, and that's why it triggered the delayed explosion. Now, there are a lot of other ideas about how that worked now, and we're not going to get into that. But if an enemy understood how we would react to a pandemic, maybe that enemy works in our big agencies. Maybe they are in all our schools. Maybe this has been a long 30 or 40 or 50 year attack that is slowly coming to fruition now. But if you knew how we would react, then you'd know that we would do propaganda for a vaccine. So that if you wanted to hurt us, you could put something in those vaccines. If you wanted to thin our herd, you could make just enough of the vaccine bad, but not enough to track, that you randomly kill people. It's a real thing.
No, it is. But the sad thing is, it was tracked. It is tracked. It was tracked. I mean, even though we know that VAERS is only at a 1%, reporting rate, right? The numbers are astronomical. You've never seen numbers like this over the last 30 years. I mean, you could take all 30 years, combine them, and we still have not hit that number that we did in 2021.
Yeah.
I mean, it just went straight up through the roof. Okay. So this is so out of character. And the fact that, and I've been screaming about this since the month it was released, I said, this is such a bad idea. I testified to it in Texas State Senate. I said, this is such a bad idea. We don't have enough safety information. We don't have enough information whatsoever on this vaccine. What we do have are signals, and they're already set off. The death signal went off. We had 1,000 deaths in the first month. 1,000. In my circle of medical friends and cohorts, the first week that it went out, we had lost somebody. The first week.
Yeah.
You see? So, I don't know. I mean, this is why a lot of us don't sleep at night. Because we know this. We see the signals, and they're ignoring it. Our federal agencies are derelict in their duty, that where they are no longer doing what they used to do, and they have destroyed our world. They have destroyed our trust in them. And
unfortunately, trust in all doctors and all of medicine.
Exactly. So they have destroyed it, and they did it on intention. So now it's like, I don't even know where we're headed. Where we were, back in the 80s and the 90s, 70% of physicians were independent. True statement. Okay. Mm-hmm. That started to rapidly change in the 2000s, late 2000s, 2010s, right? So I saw an analysis a couple of years ago, because every couple of years we see this big analysis, like where do doctors get their income from? And, they do this big analysis. How much do we get paid? The whole thing. Most of it's garbage, but But what you do see is the trend. You see the trend. It flip-flopped. It completely has flipped. So, back in 2000, 70% of our physicians were independent, and now 70% of our physicians are now employed. Only 30% are independent. And that really is a state-to-state variance. Texas has one of the highest rates of independent physicians.
That explains why we had fighters come from there.
It's not very high. And I can tell you in my area, we had 40 pediatricians when I first went out into practice. There was 40 of us in a very small area. Of that 40, there was more than half of us were independent. More than half. And if you fast forward to now, there's, I think, 7 of us left.
I think we need to break the hospitals up.
The hospitals are buying out our practices, or the large systems were buying out our practices.
We need to and we need to encourage and foster independent practice. Right.
But it's not doable when you're dealing with an EMR. So the only way that we can foster independent thought again and independence is to get out of the insurance industry. There is no way that we can be a part of CMS, which is Medicaid and Medicare. So third payers that are attached to the government have to go.
Yeah.
And so do insurance companies overall.
And also,
they have to go.
Would you say that hospitals are incentivized to have patients on ventilators diagnosed with COVID?
Okay, well, there was an analysis done about a year ago, and the answer to that was yes, because that was one of the things that we saw. So again, here's my observation, right? I told you I just observe things and I see things. So remember I told you in March of 2020 when the shutdown happened, I was one of the only physician offices open. All right, all the outpatient centers in our area were closed. They shut down the hospitals for anything that was outside of emergency surgery. So really there was no surgeries going on. There were no treatments going on except for life-saving treatments like dialysis. So if you observe this and you understand how economics works, and I used to work in a hospital system, so I know exactly where their cost was and how they make their money and everything. Mm-hmm. They make their money in the outpatient realm. They make their money on non-emergent surgeries, scheduled surgeries. That's how they make their money. Well, when you shut down a hospital for months at a time, where's their income?
Right.
It's gone. Then all of a sudden what happened? So then all of a sudden the PPP thing came up and all this stuff, right? Well, oddly enough, one of the hospitals that's close to us announced in June of 2020 that they were in danger of going bankrupt. They were probably going to go bankrupt, and they had to open up non-emergent surgeries again. So they were opening up, and they were telling people, we're going to start doing our surgeries again. We're going to start doing our outpatient treatments again. It's going to be very limited. It was that ridiculous, 75%. They could see 25% or something, whatever their weirdness was. And so I'm thinking to myself, oh my gosh, that's like crazy. These large hospitals, yeah, this makes sense because they closed down. So of course they're going to go bankrupt. This makes sense to me. Well, then how is it that in December of 2020, the same hospital who was saying not 6 months prior that they were going to go bankrupt now has a major windfall profit for a hospital that's considered a nonprofit? Go figure that one out. So what happened? Everyone had COVID. So if you had the new diagnosis code of U07.0, mm-hmm. which is the COVID diagnosis code, you got extra money. Hmm. So we know that it makes sense, right? If you do it once or twice, it's not a big deal. But if you do it hundreds of times, that money starts to rack up. And then if it has another diagnosis code that included ventilation, they added another. If you went to the ICU, they added another tag on. So for normal hospitalizations, people got out of the hospital pretty darn quick. Like there was a whole cost containment issue. You have to, there's this IRB, where they tell you can't keep people RVUs, you can't keep people more than X amount of days for X amount of diagnosis code, whatever. And all of a sudden, we go from kicking moms out in 48 hours that have a baby that might have some complication. They have to go in 48 hours, okay? Or else their insurance won't pay for it. To people in ICUs for 22 days.
Yeah.
Some of them that don't even need to be in the ICU. But they were putting them in there. Why? Because they got 22 days extra of payment. And then on top of that, depending on their treatment, which again, we've never monetized treatment ever in the past. We've never said, oh, you get more money if you're on a ventilator. We know it costs more, right? That makes sense. If you're using more technology and you have higher level of care, yeah, it's going to cost more. That makes sense. But since when were patients that were breathing 92% on room air getting intubated for that reason?
And you put them on there, they have a greater risk of hospital-acquired infections.
Absolutely.
A higher risk of death.
But why is that? Because no one was allowed at the bedside. Here again, they had no advocate. There was nobody there to watch over them and to help them and to defend them. They were given medications that not only did they not need, because remdesivir, just hit that one. Remdesivir is for now. It's ridiculous what they're doing.
No.
Anyway, remdesivir
that's for our next 2-hour chat.
Yeah, but remdesivir is one of those things where you're looking at it and you're going, okay, this is for acute COVID, but these people had COVID 14 days ago. There's no reason to give them remdesivir when the virus is gone.
Right.
On day 8, it's gone.
Yeah.
They can't find it anymore. So why in the world would they resort to that? It had to be monetized. These things were all monetized. That is why it's corrupt.
I want to show you this before we go. This is from Dr. Gosselin's trial. Not this past, or whatever you call it, defending your medical decisions for writing 5 or 6 waivers for an experimental inoculation. We don't even want to call it a vaccine. Anyway, this is Dr. Catherine Brandt, who I think is also a professor, physician, and she is explaining. Well, she's an expert witness against Dr. Gosselin. Let's see.
We were just remembering in my opening statement, I had discussed VAERS, the VAERS Federal Vaccine Adverse Event Reporting System. And I mentioned some statistics. Now, I'm not asking you to agree that those statistics are accurate, but just assume that they are for the purposes of my question. And my question is, with those statistics, do you agree with me that if they're accurate, they constitute a signal from the system that there could be a problem with these vaccines?
No.
Okay, and why is that?
I think it's more complicated than that.
Okay. And can you explain the complication?
So this is a process that goes on with any new medication. There are many layers of clinical trial that go on, and there is, they go through stages 1, 2, 3. We don't need to get into that for these purposes, but those are levels of trial that go on prior to medications or vaccines reaching the market. There is then essentially stage 4, which is observation that goes on after market. There has been very intense scrutiny of effects and side effects of these vaccines, as there is for any vaccines. As you discussed, that was the process that eventually caused the original rotavirus vaccine to be pulled from the market. This is how this procedure works.
So, yeah, I just, she said no.
No words. There's no words. This is someone who's been bought
She looks like she wants to be out of that room. But earlier in the interview,
how can you say that the same thing happened with rotavirus if you actually if let's just assume for a moment that she really does understand that rotavirus was pulled for 51 cases of intussusception, which is non-deadly. No deaths occurred. Okay. Now, rotavirus went through the rigorous trials. They went through the 3 to 5 years of safety data before it was introduced. It got introduced. They see a signal. They pull it. How can she say that looking at VAERS data with a straight face that it doesn't show her a signal? How many people have to die before she sees a signal? Like, even with our worst disaster in history, which was the swine flu of that was given out, I think, in 95, right? 25 people died. They pulled it off the market immediately, and at the end of the day, I think 59 people died, right? But the signal was, oh my goodness, there's a death. And so they started to look at it and follow it closer, and boom, number 25 hit. They said, that's it, shut it down, we're done.
Yeah.
That would have been the first week. That would have been the first week of this vaccine being probably the first 3 days, honestly. There were problems immediately. And for someone a physician or whatever she is, a PhD, I don't care, whatever she is, if she's a scientist or a medical personnel, how dare she lie that blatantly? Right. Either you're just completely oblivious and you're living under a rock and you're blind to those numbers, because there's no way that even a layperson could say, oh, you mean 25 people died with swine flu and they pulled it, 51 kids had intussusception and they pulled it, and now you're trying to tell me that in the first month of giving out the new COVID mRNA technology genetic modifier that over 1,000 people died that first month and they did nothing? Yeah, isn't that amazing? Mm-hmm. Like, how do you make that association if you're a scientist?
That whole thing with Dr. Gosselin was such a... I could tell some of the doctors on the board were like, why are we here? But it's like they had to have something to justify why they put him through that whole mess.
That's going to be the same thing with me in September. It's going to be the same exact thing. I mean, I told you the story. It's pretty blatant. There's no harm, no foul. This wasn't anything against the patient. The patient had a great outcome. We weren't doing anything different than we normally do, how we practice medicine. And this is a witch hunt. They know who I am. They looked me up. They were looking for an excuse. This thing should have been thrown out with the preliminary investigation or whatever they call it. Because I've never in 25 years have ever had anything. I've had one complaint in my entire career, and that was, again, between divorced parents who were fighting amongst themselves, and I got caught in the middle. So, I have a clean record. I have great reviews. I've been doing the best I could do for the last 25 years to service my patients, and it's a witch hunt. And frankly, John, I tell people this all the time, I'm not afraid. There's no room for fear right now at all. No. Maybe I'm blind or silly or ignorant or whatever. I mean, I know there's danger out there. I'm not that much of a moron, but I'll tell you, I just there's no room for fear. I don't fear anything. I don't fear losing my license. Let them take it. They're not going to change this. They're not going to change who I am. They're not going to change what I do.
At this point, not being a doctor seems like it might be a wise choice. Because people are going to start coming for them.
Doctors don't... I think a lot of people really don't understand a lot of doctors, because people think that you just go to school and you become a doctor. Doctors have to be driven. You have to have an internal, it's a calling. All of us doctors will say this. Anyone that took that oath seriously, they will all tell you the same thing. We were called to do this. I mean, think about it, John. Think about it. I'm the daughter of an immigrant who came from a Holocaust camp. Mm-hmm. And I became a doctor. How does that even happen in one generation?
Yeah.
Right? My mother didn't even speak the language of the country. And and in 10 short years from the time she stepped foot on our shores, it was probably not even 15 years, I was born. And, you know, and then if you fast forward 20 years from that, I'm going into med school. Like, never in my mother's wildest dreams would she think that she was going to have a child that became a doctor. So this is the greatest country no matter what. I don't care what anyone says. Yeah. You know, I'm still waiting for a bunch of our Hollywood morons to go up to Canada and get locked down. I mean, this is ridiculous. Just
it's too cold for them.
Whatever. They said they hate our country. Go to China. I hear immigration there is wide open. But this is the kind of nonsense that we are dealing with as Americans. The people that are patriots and understand our Constitution and understand what's going on. And really, you don't even have to understand it all. You just have to, like, open your eyes and remember what you learned as a child when we really had history, when we really had education. You know, they had 60 years to prepare for this.
Yeah.
And we've had 2. So if you think of it that way, how quickly we doctors, we are used to a straight up learning curve. I mean, our first year out of residency or out of med school, man, we learn so much in those first couple of months. It is ridiculous. Mm-hmm. And it's all on your feet, training you have to know this stuff. So we were prepared for this. We were prepared to learn in a very straight up going learning curve. We understand this.
Well,
we don't have the money. We don't have the finances behind us, but we have the fight and we don't care. We're going to do this. I mean, I can't tell you how much of my own personal money I have dedicated to the Patriot movement at this point.
Yeah.
For this, to save our kids.
Yeah, I couldn't do marketing for flippant movies when this was happening. Maybe someday I'll return to that old life, but I don't feel like I have any interest in it anymore. There's an actual world that needs people like me to do this.
Absolutely.
So that's why we're
absolutely. So I don't know if you've seen we have some documentaries out. I don't know if you've seen our documentaries. We have Seeing 2020.
Okay.
So look us up for Seeing 2020. We have a sequel. I was featured in the first, me and a bunch of other doctors too. Of the American Frontline Doctors, we were featured in that documentary, and then they had a sequel to it recently, and there's 2 more that are coming out. They have so much content that they are able to make 4 documentaries. Okay. And so, I think it's important for people, because people relate to movies in this country. You know, we're very entertainment oriented. Mm-hmm. And these are, educational movies or docucations or whatever you guys call them.
I know what you mean. It doesn't quite feel like a documentary. It's not quite news. It's really sort of like a recap stories. Of history.
Yeah, we tell our stories. We tell us, and that's recording history, and I think that's so important. And there's so many of you guys that do awesome work in documentaries. I mean, I'm not a Hollywood girl. Like, I don't go to the movies. I don't care about actors. I wouldn't know them if they punched me in the head. I mean, honestly, sure. Like, unless you're super uber mega famous from the 1980s, I probably wouldn't know who they were. Right. So, that's just kind of where I roll. And so for me, that was not my forefront. However, I know I'm weird. Like, I'm one of those outliers that don't do that, because people go to the movies all the time. That's a big entertainment for them. That's where they spend a good chunk of their change, and that's fine. That's what they choose to do. But I understand the importance of what you guys do, the podcasters, because I'm technologically very...
It may be the only power left right now. It seems like the only way to get the government to do anything was to create outrage.
Right.
And that's what we're going to do. So, yeah, I'll post links to these movies, and if you have any other links to send me, we'll make sure they get listed at the bottom of this. And Dr. Farella, I really appreciate you coming up. Obviously, this was a miserable interview. It only lasted 2 hours and 15 minutes.
Sorry. You get me on my passion points, and I'll just like...
Yeah, I know. I am the same way. Well, whoever listens to this whole thing will be on a long drive somewhere, probably.
Well, just chop it up, John.
There you go. Yeah, you know what? I think all these things will be great, because I'll have little snippets that I can use here or there for maybe a different, longer documentary. So, thank you, Dr.
That's awesome.
I'll talk to you soon.
Thank you, sir. Have a good night.
You